Okay, folks, we're going to go ahead and get started. It's great to see everybody, and I know that there's some others that are going to be joining us in a little bit. My name is Maria Oliva Hemker, and I'm your Vice Dean for Faculty. I'm being joined up here by Rachel Levine, who's an Associate Dean for Faculty Educational Development, and she is going to be your host for today's event. And so this is faculty orientation on more of a School of Medicine level. I know that all of you have been here, and hopefully you have already received some degree of orientation from your divisions and your departments, because those are really your home base. But we wanted to make sure that you had the opportunity to hear about resources and to hear from people beyond your division and your department. And so this morning we're going to have a few sections for you. We're going to start actually with you meeting the leaders of Hopkins Hospital and your CEO and Dean of the School of Medicine and the Executive Vice Dean. They will be coming up here for a panel to talk to you, so you're going to be hearing from them. Then you're going to be hearing about other aspects of the School of Medicine, your Office of Faculty, the Office of Well-Being. You're going to be hearing about the Office of Diversity, Inclusion, and Health Equity. And then there's going to be a section where it's sort of like a speed dating kind of section. You're going to be hearing about every 5 or 10 minutes a different person come up and talk to you about resources. Then there's going to be some section on promotions. And then for lunch, you're going to be meeting some of your own colleagues who have gone through various promotion processes, so you can hear directly from them and ask them questions. So it's going to be a bit of a packed day. Just so you are aware, this is actually going to be taped, and it's going to be available to you and to other colleagues in our Office of Faculty YouTube channel. So you'll be able to see slides, and if you didn't catch anything, they will be there available for you. So thank you again for coming. It's great to have you here, and I'm going to now pass the baton to Rachel, who will start the program and introduce the panel.
Great, thank you. Wonderful. Good morning, everyone. It's really wonderful to see you here. I want to welcome you. I want to also remind you that you are going to be receiving a ton of information today. We're going to provide all of this to you in slides and an opportunity to access the information. The big message for today is welcome, welcome, welcome. We're thrilled that you're here. You belong here. We're here to support you. So with that, I'm going to invite our panelists to come on up to the stage. I'd like to introduce, we have our Dean, Ted DeWeese, who is the Dean of the Medical Faculty and CEO of Johns Hopkins Medicine. We have Mr. Kevin Sowers, who is the President of Johns Hopkins Health Systems. We have Landon King. Dr. King is the Executive Vice Dean of the School of Medicine, and Dr. Redonda Miller, who is our President of Johns Hopkins Hospital. So we have mics. I believe this one is on, and I hope the other one is on. So I have some questions I'm going to ask this morning. This is really an opportunity for all of you to get to know our leadership here at Johns Hopkins. I'm going to ask some questions to everyone, and some I'm going to invite individual leaders to answer. So this question is for everyone. And I just want our panelists to kind of look out and remember what it was like to be an early career individual, right? And so remember this. And I'm going to ask you, as someone who's been at Hopkins for a long time and who's been successful, what bit of wisdom have you acquired that you wish you had known when you were starting your career? So something you wish you had known when you were sitting in these seats a while ago. And maybe we could just start here, Dr. King, and then we'll move across our panels.
Well, good morning, and thank you, Rachel. Welcome to Johns Hopkins, and congratulations. That you are here means that you have done extremely well for a long time in whatever you do. And so we are so pleased and proud to have you a part of our community. To Rachel's question, I think a couple of things probably come to mind. So one, is that we are surrounded by amazing colleagues here. Engage with them. This is a big sandbox, basically, full of kids looking for other kids to play with. That's what life at Johns Hopkins is like. But the other part of that is that we don't give you a perpetually stocked refrigerator. We give you a hunting license in an incredibly rich field that we put a lot of energy into extending and sustaining. And so the opportunity is immense, but a lot of it comes to you and your interest and willingness to engage with the other kids in the sandbox to go seize the opportunities that I think are really, really abundant in this hunting field.
Good morning. What he said. It is really an absolute pleasure to see all of you here. I'll just reinforce how important it is for us that you are here. I know you have all, as Landon noted, succeeded so to the highest degrees in all the things that you've done, and to have you as part of this family is so uplifting to all of us, so thank you for being here. I wish I would have known that I was going to stay as bad looking as I was then as I am now, except worse. My bar was always low, and it's gotten just lower with the stuff I've done here. But I think beyond the hunting license thing that Landon talked about, I think the two best pieces of advice that I received from my mentor many years ago, which I think are still accurate, are number one, make sure you stay on target. There's so many things that can distract you and that are distracting. It's a complicated environment. It's a complicated world now, probably more than it's ever been, of course. And so lots of things can be distracting. So understand what your goals are, what it is you personally and professionally want to achieve. Make sure there's alignment of what you want to do with your department, and just stay on target. There's a lot of things that are bright, shiny objects along the road. Just mostly let them go. Stay on what it is you do. And the second one, because this is a big, wonderful sandbox with a lot of Tonkin trucks and various things inside the sandbox, as my mentor said, there's 1,000 cool things to work on. Don't do that. You can just figure out what the 3 most important things that you think of the 1,000 are and focus on them, because if you're flitting around too much, which is great fun, and it's great excitement, and it's intellectually stimulating, what have you actually achieved? I don't mean personally, because you'll continue to write papers and maybe you'll get some grants, but what are you actually contributing to do what we do, is to do discovery that changes the human condition? And what's your role in that going to be? And if you're doing 1,000 things, unless you're Bert Vogelstein, most of us are mere mortals and can't do that. So stay on target, stay focused on the things that you'd like to do, like you've achieved, make sure it's aligned with the people that you work with, and have a great amount of fun doing it, because it's great fun. So again, welcome.
Good morning. Sorry about that. Scared myself. Listen, I'm not here as long as the people sitting to my right and my left. I joined Hopkins 7 years ago after having been in Duke for 32 years as the president of the health system. And it's been an extreme pleasure. And one thing I would say to you is, to Landon's point, you're in a big sandbox. I've never seen a culture that is so collaborative and so supportive. So know that. Coming in, that was a unique experience for me in terms of everybody wanting to try to help solve an issue. The 3 things I would say to you is, number 1, know what you know and admit what you don't know. And which takes me to the second one, is the importance of collaboration. And collaboration with people who don't know your space but know other spaces, and you'll learn much more by spending time with them than only staying in the space that you know. And the third thing is, you cannot be successful without the team. Never lose sight of that the team around you is incredibly important as you begin your early career, and they can make you successful. So the importance of team and the value of that. Welcome, and I'm glad you're here.
Hi, everyone. I'll just echo my welcome. Redonda Miller. I've been here 36 years, a really long time. And there's a reason for that, right? I love it. And you guys will too. When I think back on what I wish I had known, I was lucky to have great mentors, and it's surprising what I'm going to tell you sort of resonates with what we already heard. It's this notion that you can do whatever you want and tap into the resources around you. And those resources, certainly some of them are typical, money or research support, but a lot of it is your fellow colleagues. If there's a will, there's a way. And, Landon says it's a hunting ground. I would agree with that. It's not a Hunger Games type situation. It is definitely very collaborative, as Kevin said. If you have an idea, it can be done. Tap into colleagues, get a group together, start it, put your name on it, and move it forward. That is what Hopkins does and is proud of.
Wonderful. Thank you all. So the next question is for our School of Medicine leadership, so for Dean DeWeese and Dr. King. So you will hear over and over that Hopkins is a really mission-driven place, and I think this is really true. So I want to ask both of you, as a leader, what's one specific ask that you have for faculty as you consider how they can contribute to the Johns Hopkins School of Medicine mission?
Thanks, Rachel. I'll be really brief on this one. I think it's very clear in my mind. Hopkins and all of you, it's about excellence and the pursuit of excellence. If you stay on that focus, no matter what it is you do, how you achieve those things, that's what our mission is about. Because if you stay with that core focus, doesn't matter, you'll achieve it, and therefore the institution will be better, the patients that we serve will be better, society at large around the world will be better. So excellence and the pursuit of excellence.
Like he said, I would say appreciate your colleagues. We really have extraordinary colleagues here, and I don't mean just within the faculty of the School of Medicine. I mean the staff in the School of Medicine, the trainees in the School of Medicine. Our colleagues on the health system side are incredibly mission-driven. And so, sort of back to my first answer, appreciating your colleagues here, I think, is an incredibly important part of being able to understand what the opportunities are, channel your own interests, and then leverage those opportunities to pursue mission, because that's what we really are driven by.
Thank you. Okay, so now I have a question. I'm going to pass this one over to Dr. Miller and again back to Dr. King. And my question is, as a leader, what is one Hopkins program or initiative that you think many faculty may not know about but should?
That is a great question, and there are many that you will discover. If I had to pick one, I'm always surprised when I talk to my colleagues in the faculty, they don't realize how engaged we are with our local community. Mr. Johns Hopkins, our founder, told the Board of Trustees you have two missions. One, discovery and excellence, be the best. But second, take care of East Baltimore. You are the community hospital for East Baltimore. And we hear a lot about the first. The second gets every bit as much attention. When we look at our community benefit, which is well close to approaching $400 million just from our hospital alone, the programs we do, certainly we have back-to-school nights and various local events, but big, impactful initiatives, such as providing houses for local residents who are homeless in partnership with Baltimore City and Healthcare for the Homeless, such as hiring people locally. We are very intent, and it's not just anyone. We intentionally take local citizens who are returning from prison and work with local nonprofits to make sure they're ready to return to work and have the skills they need. We bring them into Hopkins Medicine. We make sure they have a coach, and often they start at an entry-level position, but we make sure they have all the access to education and training and coaching to advance their careers right up the chain. I can't tell you how proud we are of this commitment to East Baltimore, and it's hospital, health system, School of Medicine, university, all fronts of Johns Hopkins Medicine are engaged. So that is what I wish you would know.
I love Redonda's answer. I came here as an intern in medicine. Redonda came as a medical student. We've both been here for our careers. We are the community hospital for East Baltimore, and it should be a great source of pride for all of us, but it takes work, and we've got to engage in that. I'm going to cheat a little bit on Rachel's question and say the one thing I would say is the Vice Dean's office. Now, so that's my entry into saying there's a bunch of stuff in there, right? So the program that's going on today, other programs through the Vice Dean for faculty, programs that are going on through the 3 Vice Deans for research, that the Vice Dean for clinical affairs is pursuing, are all mission-driven programs, but in particular are enriched for trying to support faculty in various ways. And it can live as a secret for quite some time unless you have a sort of a specific interest that comes to mind. And so I would say avail yourself of opportunities that are being put together and operated through the Vice Dean's offices, because they really are about you.
Thank you. Thank you for the advertisement. That was awesome. You're going to hear a ton about programs to support you through the Vice Dean's office, and thank you, Dr. Miller. There are some amazing community-based programs at Hopkins across the university, Medicine for the Greater Good. There are just amazing opportunities for us to engage with our community, and we really, really do value and focus on that. Okay, so this question is for Mr. Sowers and Dean Jalise. So what advice do you have for new faculty about work-life integration? How have you approached this during different periods of your career?
I'm sorry, what was the first, work-life?
Work-life integration, yeah, so great question. That might mean different things to different folks, but it's really about how do we integrate our personal and our professional lives.
Yeah. That was a lame attempt at a joke there, of course.
Oh, okay, I got you.
I got it.
Yeah. You know what, and I've been asked, like Redonda, like Ryan and I've been here since I came out of medical school, and entering as a faculty member, and I remember my lab was right up on the 3rd floor, like not too far from the Ross building, and I was with someone else who was joining the faculty in oncology as well at the same time, so we shared this tiny little space. It was like the best time of my life, but it was fantastic. And I'll just tell the story because I think it represents, right, so I am married, and at that point I had 2 very young children, and so I was running my lab in the clinic, so I would do that. I would stay late until everything was done. I would always get home in time to make sure I was read a story to my children, get them to bed. I was not always home for dinner. But I was done on Friday. Saturday morning, I would get up super early to complete whatever I needed to, but by the time the kids got up and my wife was up, I spent the entire weekend undistracted from them. My dear friend, who was my colleague at the time, he took his daughter was a little bit older. He made sure he got her to kindergarten every morning, and he would come to work, and then he would leave, and he would be home most nights for dinner, and then he would come back. And he'd work very late, and then he'd work on Saturday and Sunday some number of hours. The only reason I tell you all that, of course, is because what worked for me would have never worked for Mike Carducci, and what was working for Mike would never have worked for me. So that was I just mean that to say what works with one person doesn't work for the other. I think you probably all know that, but I will say one last thing that I did not do well, so forgive me for sharing that. I didn't talk with my wife enough. What is it she needed from me? I didn't communicate enough about that, and so that was problematic early on. It was my fault. I learned very quickly what I should have been doing, but being much more communicative about, because her life wasn't medicine, and so she didn't have the same idea of what I was trying to manage, and I wasn't as responsive and communicative to her as I should have been. So communicative, but what works for you will work for you. Just making sure everybody's on the same page in your family.
So I would say I sucked at it at the beginning. I say that tongue in cheek, but I think when you're an early careerist, you do work extra hard, and you don't always recognize the boundaries that you need to be successful in both your personal and professional life. And so I challenge you as early careerists. I get asked this question a lot because of the generational differences we have in our organizations. To my dear friend here, we are from the same generation, and we were taught to work the work. There's a generation now that's in our workforce that was taught to balance more of what they need in their personal life than they do in their work life. And people ask me which is right and which is wrong, and I always say maybe we got it wrong. To Ted's point, I would say the number one issue that I coach people on now is early on in your career, if you're choosing a spouse or a partner or significant other, choose someone and have the conversation up front of what your life is going to be like, because it's not going to be like everybody else's life, and make sure somebody's comfortable with that. But I would say that, like Ted, I made mistakes early on, and I didn't think about how to communicate that effectively and manage that piece in my personal life. The professional part was actually just working the work and getting that done, but the personal part was probably where I balanced my time in communicating what you needed as a couple in your personal lives.
Thank you. Thank you. I appreciate hearing both that a real understanding that this is different for everyone, and I think we all know and feel that, and also your willingness to share, your own kind of vulnerability around the journey, right, of this process and when you've made mistakes and how you've addressed that. So thank you for that. So the next question I'm going to ask of Dr. Miller and Mr. Sowers. So this one is about communication in a large organization. So we are a big organization. You're going to get a ton of information today. And this can be really difficult communicating with a large faculty and a large staff. So what's one message that you wish to share with all faculty?
Are you saying, Rachel, this is my chance to communicate something?
This is your chance.
Okay.
This is your chance.
Sometimes I think one message is sometimes in our day-to-day work we get very caught up in, well, this is my lane and this is my department or this is my team, and we get very focused insularly. And one message I would like to convey is that we are all in this together. Sometimes I hear, well, hospital, health system, or school of medicine, university. I can tell you, once again, I'm going back to our founder, all of us share the same principles. Commitment to excellence and discovery and innovation, including the health system hospital side. We innovate in healthcare delivery every day. We are all very mission-oriented, putting the patient first in everything we do, whether you're in the lab, whether you're on the wards. So one message is sometimes when you may be in whatever silo is your day-to-day world, think very
message I would want you to understand and know is that if you don't, first of all, communicate. So because when you're talking about 45,000 people, that's a lot of communication, and we don't always get it right. I think one of the greatest challenges you have to step back and consider with us is that from a health system perspective, when we go to communicate, we have a hospital in Washington, D.C., which is a very different jurisdiction. So how we think about the politics and the certificate of need and everything that we've got going on there, very different than when I come to Maryland, where we have a waiver. And I'm sure you'll hear a lot about the waiver. And if somebody says it tells you not to grow, yes, currently the waiver does. But these folks will tell you I'm working very hard to make that different for us in Maryland as we negotiate the new waiver. But then you go to Florida, and you have a children's hospital down there that is from a very different place than the other two places I just spoke to. So part of the time is we have to craft our messaging and our communication based upon the jurisdiction in which we're communicating, even in segmenting the market and even thinking about how we manage that message. So If you hear a different message going to Florida, there might be a reason that it's different there. I take, for instance, a real-life example of where we had to deal with our transgender program. We had a significant transgender program, but what we had to communicate there was very differently than what we communicated here in Maryland because of our governor's actions from a legal law perspective. And so when you hear those differences, don't go, what's going on? Really stop and think about why some of the messages might be different. But the one message I'd want you to walk out of here today, yes, we do have a waiver in Maryland, but the waiver is not going to limit our ability to grow as in the region and be what Johns Hopkins originally intended us to be in terms of not just serving East Baltimore, but the entire region, and not lose sight of our regional and global perspective.
Thank you both. So this is sort of a question to follow up on that, and this is a question for everyone. So from where you're sitting, figuratively, what is the best way for faculty to bring questions or ideas to you?
That's a great question. Look, I know I can speak for all of my colleagues up here about our willingness and effectively open door kind of policy. If there's something seriously happening, there's lots of avenues for you to communicate that. But if you felt so compelled, we're here. So I don't want to have that lost in this shuffle. But I think more practically speaking, your department director or your division director is probably, from a school of medicine point of view, is probably the most effective person for you to communicate with, that then would roll up to us for us to hear that. Because, you know, I'm not a particularly large chain of command kind of person in that respect, although if you just sort of think about, as Kevin said, 45,000 people here, the people who know what's going on best in the department where you might be, or going to be the division director and the department director, who then can put it into context, maybe the issue for you, or support you in a way that coming directly to me or to Landon or to Kevin might not have, probably wouldn't have the same perspective, and therefore we probably roll it back down to the department director to discuss it and try to get back to you. So I think generally speaking, division director, department director, that could come to us through the vice deans that Landon talked about, the vice dean for faculty, Dr. Oliva Hemker, Rachel as well. So I think that general process and path typically works the best. Landon?
The only thing I would say on the health system side, no matter where you're practicing, I would get to know the leadership team of that organization so that you can communicate directly with them if you're having practice problems. That's incredibly important to try to solve that at the local level. If you feel like it's not being solved, you need to raise that up. There's a variety of mechanisms to raise that up within the health system. There's a Speak to Us line that you can call. You can call that anonymously if you see something that's going on that you don't feel comfortable putting your name to. If there's safety events, there's a safety event reporting system. There are emails that come to all of us. So there's a variety of different ways to reach out and to communicate around specific different types of issues.
I don't think I have much to add. We do love it. I'll just speak for the Johns Hopkins Hospital leadership team. We do love it when you have ideas and share them with us. We think some of the best ideas come through that route. But to echo Ted, we do tend to involve the clinical directors as well, just because you could imagine the number of ideas that come from this organization, all wonderful. So we really rely on our clinical directors, which are the heads of each department, to help us prioritize which should be pursued this year versus next, what's a departmental priority. So I think both avenues are very appropriate, but we will engage with your clinical directors too.
Thank you. Thank you all for that. So we're going to wrap up with this question. I'm going to invite Dean DeWeese to respond, and then if anyone on our panel would like to add. But I'm going to ask you if you would share any important changes that you think are coming at Johns Hopkins and that faculty should be aware of.
Ooh, that's a great question. There is a ton. One, I will just put a pin in, and I hope you'll forgive me for not being able to expand on it today, but we have been so hyper-focused, and when I say we, I mean the large we in executive leadership team, on faculty salaries. And so there's more to be coming on that in the relative near future. So let me, if you allow me, just to put a pin in that one for now, but you'll hear much more about that. Secondly, there is, if you look right across the street from here, as you see, the crane is now gone, but there's still the construction and renovations of the former Children's Center, which is now going to be, I'll look at Landon, 250,000 square feet, roughly speaking, a brand new laboratory space. Largely has a neuroscience focus, but there's some other things in that too. So that's just about to be launched in about a year from now. It's fantastic. For those of you who've been here for a while, if you just go down the block a little bit, Monument and Broadway, right on that corner, there's 3 buildings that will be coming down probably roughly starting in December, approximately, where we will be building a 550,000 square feet brand new state-of-the-art, arguably speaking, and I'm biased, but I think it's true, most advanced life sciences building in the world, right there on that plot of land. And then if you just continue up Monument Street, there'll be more to be going on at School of Public Health, with whom we partner, a new building that's actually already under construction there, and then ultimately some renovations of where we are here, the renovations of basic science quads that are here. So all of that's great. And thirdly, I suppose, will be something that Kevin and I will be helping to lead in the relative near future, which is a new 5-year strategic planning exercise for all of Johns Hopkins Medicine. Those sorts of things are gigantic. There's many, many, many thousands of people who will be talked to and engaged, and we'll have some other folks supporting us, but that is a really important part of our collective future, because Johns Hopkins Medicine, this entity that it is all about driving back to the points we've all made here, I think, who it is we want to be for Baltimore and who it is the world needs us to be. And that's what the strategic plan for Johns Hopkins Medicine about, for how the school and the health system come together to drive to that set of goals. Make sure we understand what the future is for us, how we are excellent, and pursue that excellence at the highest level. And so that exercise will be started in this academic year, and you'll see much more about that and the engagement around it. Kevin.
So the only other thing I would add is just our commitment to growth. When I first came to Hopkins 7 years ago, we pulled the health system leadership and the School of Medicine leadership together and developed something called the Clinical Roadmap, because it was recognized that there were parts of our region that needed to be served that was being underserved, and especially as we looked at where all the places we are, the National Capital Region, then we have Howard County, and then we have our East Baltimore strategy, and then we have our Florida strategy. And part of what we decided as a team was to start our focus in the National Capital Region. You'll see the Sidney Kimmel Cancer Center and a Proton Therapy Center was one of the first steps that was taken at Sibley Hospital. If you've not been to Sibley or Suburban, while they're only 4 miles away, it can take you 45 minutes to get from hospital to hospital. No, I'm not making that up, okay? I wish I was. So when you look at the segmentation of the market and thinking about the 2 hospitals being that close, we really did differentiate and restructured. And there's a president of the National Capital Region that really has helped set the stage for that, but really diversified what services is at Sibley versus a suburban hospital, and then committed to building 2 large outpatient sites, a 30,000 square foot site in Arlington, which will open this fall, multi-specialty with primary care and urgent care, and then West Falls Church. believe it or not, in Northern Virginia, it's hard to get a primary care physician. And Ted will tell you, whenever we put a primary care practice down, it surpasses any metric you'd ever want within the first year. And it's because that's a market that has gone almost completely to concierge medicine. And so there's a lot of Medicare recipients in that community that do not have access. We then come back to Florida was our second strategy. There's a hospital that we will be building north of Tampa in a community where it's the fastest growing community in the United States that are having children, 12% growth in the next 5 years of children. And so no children's services there, so we're doing that. And then my dear friend Redonda and Jen Nichols, who's the president of Bayview, are now really focusing on what's our strategy for East Baltimore. Because as you look at what's at Bayview versus Johns Hopkins Hospital, it kind of grew up organically, which is not a bad thing, but you really do need to step back and go, okay, for the next 10 years, what does this have to look like, especially when we start thinking about needing to replace Bayview as a bed tower. So that's part of what I wanted you to know is our commitment to growth.
Wonderful. Any other comments?
I'm just going to segue on to the last part that Kevin mentioned. For you who practice locally, some changes that you should be aware about. We are working very, very closely with Johns Hopkins Bayview to align in the future, 7 years out, where programs will be, what kind of capacity do we need. We are filled. It is a good problem to have. Both Bayview and here, we have patients knocking at the door every day. And honestly, that's a testament to you all who see patients and the care that's delivered here. It's really tremendous. But we need to accommodate that demand. And so long term, as Kevin mentioned, we're thinking through what the strategy would be. Short term, I think there are changes that many of the faculty know, but you guys are new. So short term, we've got to get through the next 7 years. And I am really asking your help in thinking through how we can create capacity in the short term. You know, are there low complexity cases that don't need to be done at the Johns Hopkins Hospital that could be done at Green Springs Station? What can we do to maximize what little space we have here in East Baltimore? Think observation units, holding units. Think about changing our models of care and how we practice. Are some patients able to be cared for in a PACU overnight instead of staying upstairs in a bed? All of these are changes that we've been aggressively working on the last several years, but because you're new to Hopkins, I need your help. So anything you could do would be terrific.
I don't have much to add all that other than to say that the things that Ted and Kevin and Redonda are talking about aren't any longer, them or just something out there. This is all about you. And so we can't do the things that we have aspired to and that we hope you will aspire to without you. And so we thank you for that and thank you for all that you will be doing. And back to an earlier question, if at any point along the way you are feeling like you're struggling and you don't know where to go, there are lots of places to go, but just email any of the four of us. It's not more complicated than that. You could just email any of us, because we can't do the things that my three colleagues have just described without you. So thank you.
Okay, that feels like a good place to wrap it up. I want to thank you all so much for coming this morning and helping us to welcome our new faculty and really speaking authentically and genuinely and letting folks know how you can contribute to Johns Hopkins and what we're doing for you. So thank you so much. Thank you. Thank you very much. Okay, we're going to just work on our slides for a moment. So everyone, just take a moment, enjoy your coffee, and we're going to restart in just a moment.